Hi, Floppycatters! Please join me in welcoming Andrea Ring, a certified classical homeopath with a passion for both animal and human wellness. Her interest in homeopathy began in 1999 after witnessing its positive impact on her dog Toby. This experience led her to pursue a career change, graduating from Vancouver Homeopathic Academy and the College of Animal Homeopathic Medicine. With over 20 years of experience, Andrea combines her knowledge of homeopathy with her extensive background in veterinary medicine. She offers a holistic approach to wellness for both people and their animal companions. Andrea, thank you for being here.
Thank you so much, Jenny, for having me.
So we just completed an interview about flea control, but when I reached out to you, I wanted to do two topics on flea control and on kidney disease with homeopathy. And you said, well, let's just do both. And I was like, okay, great. So this is our second recording, and I mentioned in the flea one, just in case people haven't seen that one, I'll publish it first. Uh, that I saw an interview with you with Dr. Jeff Grognett, and you talked in that interview about homeopathy for cats, and I really enjoyed it. And sorry to embarrass you again, but I really also enjoyed your voice.
Oh,
I know that you have a history in broadcasting, and so it's just very soothing and nice to listen to. And so, but I also really enjoyed the things that you said, and I feel very drawn to homeopathy right now that I need to learn more about it for my cat. And I almost said the plural version. That's why I kind of just stopped and I was like, ugh, I hate that. Um, for those of you that don't know, I just lost a cat, and so I'm trying to get used to saying it singularly and not plurally. So, thank you for being here. And today's topic is kidney disease.
thank you, Jenny. Thank you. And I'm so sorry about the loss of your kitty. It
Thank you.
is really hard. I know it's pretty fresh for you. So,
Yes.
kidney disease. Yeah, kidney disease is probably one of the number one things we deal with our cats. And when we talk about kidney disease, like any disease process or any issue, it's always looking at preventing it before it happens and trying to get to the root cause of why it's going on so that we can address it better and prevent it better. So, one of the main things that causes kidney disease in cats is dry food diets. And the reason for that is because cats, by nature, are not very efficient or they don't seek out water. When they are on a dry food diet, they have to drink a lot of water, and they're not very efficient water drinkers. So, not only does their body have to drink enough water to hydrate the food to break it down into digestion, they need to drink enough water to keep themselves hydrated at the same time. So a cat's tongue is like a dipstick. It's not like a dog that laps up and can drink half a bowl of water in a few, 30 seconds. They sit at a water bowl and their tongue goes in and out. They don't actually consume much water. So they don't have a high thirst drive by nature. They're descended from desert animals, and they don't drink. They're not able to drink very much at a time. So cats that are on dry food are generally in a state of chronic dehydration. So this affects the kidneys in a dramatic way. So when they get older, one of the first things we see is renal insufficiency or the start of kidney disease. And the problem with kidneys is they don't regenerate very well. So as opposed to the liver cells turn over very, very well. As we all know, our liver can take a lot of beating and recover. The kidneys can't do that. So once you start having degeneration in kidneys, it's very hard to get that to turn around. And what happens is once you see the start of renal insufficiency on blood work and the actual symptom picture of drinking lots, peeing lots, vomiting, starting to go off their food. This is sort of the classical picture of kidney disease in cats. The kidneys are also already so damaged that it's really hard to turn that ship around.
Yeah.
So So feeding a moist diet is really, really important to prevent kidney disease, and especially if they have kidney disease. Giving fluids is often one of the things that you do with more advanced kidney disease, but more moisture in the diet. So either feeding a species appropriate raw diet or a moisture rich canned food, or a
Yes.
homemade food that's got, more moisture in it. Dry food has
Yes.
the least amount of moisture. It's going to contribute more to that kidney problem.
Yes. Indeed. So one of my interests, my cat that's left, Charlie, he has kidney disease. My vet won't really tell me what stage. She says I don't like to say stages. I like to treat the patient. I don't like to treat stages.
Mhm.
Uh, so he is my fifth kidney cat,
Wow.
and the first raw fed one though. Now, but he's only been raw fed for, like I said in our other interview, for since August of 22.
Okay.
So he's almost been raw fed for 2 years, and I recently did switch him to bone or to eggshell from bone, and kind of switched it entirely because what he was on, I couldn't take apart, so I ended up using a completer, and so that's what he's on now. Um, but what I'd like to do is learn more about how to treat him with homeopathy and other supplements rather than going to Serenia and all the appetite stimulants and all of those drugs that they put him on,
Hmm.
because I really, I just hate that whole process. He is getting fluids, so that's fine. I'm used to that
Yeah.
whole process.
Yeah. Treating kidney disease homeopathically in cats or any other animals, or in people for that matter, um, can be very effective. So, with conventional medicine, conventional veterinary medicine does not have a lot of tools to deal with kidney disease. So, you can support the kidneys with some supplements. You can do medications to reduce the amount of vomiting and nausea that cats get because they get a toxic buildup in their body of blood urea nitrogen and creatinine are the two main things that we see on blood work that are elevated with kidney disease. And you also get lower specific gravity or concentration of urine because their kidneys are not concentrating those toxins very well. They're ending up in the bloodstream. You can have high phosphorus in the bloodstream, high protein urea, and high phosphorus. So there's not a lot that conventional medicine can do for kidneys. They usually just say this is a degenerative process. We'll just support the cat as best we can. Giving fluids is helpful. Putting them on a moist diet is helpful. But homeopathically, we've had really good success. I've had really good success with treating kidney disease. So the diet is really important. So putting them on a moist diet. So a raw diet is great. If you can't do that, then canned food. It's really important to get them off dry food, or even moistening their dry food if they won't eat anything else. So homeopathically, um, there are four really incredible remedies for kidney disease in our cats. One is berberis, another is phosphorus, another is serum anguilla,
Hmm.
and the fourth remedy is thiocinaminum. So here's an example. We have been talking before about classical homeopathy, constitutional prescribing, and doing combination remedies. So in a case of kidney disease, you're going to find try to find a constitutional remedy that fits the whole picture, but you're also going to use, and this is how I practice, I use a combination of those four remedies in a lower potency for early stage kidney disease, and in higher potency or in a potency cord like a 6C, 30C, and even possibly a 200C if we have more advanced kidney disease, of all of those remedies combined to try to get the kidneys to regenerate. And surprisingly, to most veterinarians when we start homeopathic treatment for kidney disease. We'll repeat the blood work and urinalysis, and we'll see that the numbers are actually improving, which is not something they're accustomed to seeing. So with more advanced, there are other remedies that come into play for more advanced kidney disease. One of those remedies is arsenicum. Arsenicum is not something I would recommend anybody use. You should be under a homeopath's care in using that remedy, because there are some cautions about that remedy as well, depending on the delicate state, how delicate a state the cat is in. Higher potencies of phosphorus. Sometimes I use Carbo-Veg. Carbo-Veg can be good for kidney disease when they're in a really depleted state. So with more advanced kidney disease, it gets a little more complicated, but those four that I mentioned are very, very helpful to help the kidneys work better and help the cells turn over. As we said, kidney cells don't turn over very well, don't regenerate very well. So I also use some herbs, diluted herbal combinations like berberis can be very good. Astragalus membranaceus is what I use. I have a tonic that I use in a diluted form for cats and dogs with liver and kidney disease. Those are two that are very good for kidneys. It's always good to support the other organs. So with kidney disease, the liver can also be affected. The pancreas can be affected because of the way kidney disease progresses. So then you can get secondary issues also from not eating and from vomiting and all of that.
Yes.
Conventional medicine then will treat with drugs to deal with the secondary effects of kidney disease. So using those four remedies in combination, very, very helpful. And we want to use them as a liquid because these are remedies we're going to be doing twice daily. So you use a dose of each of the remedies in a liquid formulation, and then you succuss the bottle 5 times before each dose. And therefore, giving daily remedies, we avoid a homeopathic proving, which can happen after about 3 weeks if you're giving the same potency of the same remedy every single day for a longer term like that.
Okay.
Homeopathic proving is where they start showing the symptoms of the remedy.
Yes.
Approving, in case people are wondering, well, what is approving? In homeopathy, the way we know which symptoms correlate with each remedy is that human beings take part in a homeopathic proving. So our remedies go back 220 years or so, and we're adding new remedies all the time. There's probably 8,000 different remedies available to us now, made from animal sources, plant sources, and mineral sources. And then some, as we talked about, no-sodes made from disease material or made from drugs. You can make remedies from drugs as well. So these remedies we know which symptoms correlate to each remedy because a healthy individual takes a dose of a remedy, usually a 30C or higher, can result in a homeopathic proving. They take that remedy every single day for 30 days. And after the 30-day proving course, they are all along reporting to their supervisor in this proving what symptoms they're experiencing. And then the symptoms in the control group can be 100 people, 200 people, 500 people that are taking part in a proving. They're all categorized into what is everybody experiencing the most and down the list. So then that's how we know which symptoms are so strong to treat these various conditions.
Got it. Got it. Have you, as you found out from our last interview, this is our time of day where we go outside, and Charlie really wants to go.
Yeah.
So, anyway, have you found that at any point you need to turn to conventional meds for a kidney cat?
Well, there aren't really a lot of conventional meds for kidney disease.
No, you're correct. I just
There's
said
no way of
no, and
treating
then yes, you're correct.
kidney disease. So you don't treat
Hey, hey.
yeah, they don't have anything for kidney disease.
Oh, I
Fluids,
guess I meant like the Serenia or any of the appetite
well,
stimulants.
the yeah, those secondary meds to deal with some of the symptoms, but there's nothing to actually treat the kidneys. Serenia
Correct.
can be used when they have nausea and vomiting.
Yes.
Mirtazapine can be used if they're off their food to stimulate appetite. You can use like things to coat the stomach if they're vomiting a lot and they've got, too much acid building up in the stomach, you know,
Yes. Yeah.
those type of things. And conventional therapy would be fluids. Um, but there's really,
So
so you can resort to conventional medicines for that, but you can also use homeopathy for that.
okay, so you do like fluids aren't really necessary when you typically work with a kidney cat or dog.
Did you say fluids?
Yes, like sub-Q.
Sub-Q, if the kidney disease is more advanced, yes, in
Okay.
cats, fluids are really, really helpful to help hydrate and flush out the kidneys.
Yes.
Um, it's a little more difficult to give dogs fluids
Oh.
just because you have to give a fairly big volume of fluids to a bigger animal, and their skin is also way tougher. So
Oh.
giving fluids to a dog, like their
Hmm.
skin is like ours, right? So you put
Hmm.
a needle underneath the skin, it's painful for them. Cat's skin is so thin, they hardly even feel it when you put the needle in, and it also heals over very quickly. So giving cats fluids, unless you've got a really fractious kind of cat that's not going to let you do it,
Yeah.
it's not as a traumatic experience for cats as it is for dogs. So fluids, very, very helpful. Early stage kidney disease, you don't really need to give fluids. They're not really at that point where they need them. But in more advanced kidney disease, yeah, fluids are life-saving.
Yes. Yes. Okay. Well, that's good to know.
Hmm.
Yeah. I would prefer not to give Charlie fluids very frequently right now, just because he doesn't enjoy it. I actually didn't think that I would be able to do it at all. Charlie's nickname at the vet is Chucky.
Oh,
So it was amazing that I could even get it done. But
wow.
um yeah. Um and so how do you find someone to work with you homeopathically if you have an animal with kidney disease? And I'm talking chronic, I'm not talking acute, but maybe we should mention something. I mean, would you treat acute the same that you would early stages?
Well, acute kidney issues are usually from some kind of a toxic insult.
Yes.
So if they've either like they're on a drug that has ended up filtering through the kidneys and caused a toxic insult to the kidneys, they've ingested some kind of a poison that's affecting the kidneys as opposed to the liver. So yeah, like acute kidney stuff, you can usually get them through with fluids, deal with the vomiting either with conventional medicine or with homeopathy, and you would use similar remedies for acute kidney insult, toxic insult to the kidneys, as you would for chronic disease. So phosphorus is really, really good. Arsenicum also can be used in acute kidney issues, and you use higher potencies when things are more acute. So higher potency being a 30C or 200C, or even a 1M if things are really, really intense, because you're always going to try to match the intensity of the symptom with the intensity of the potency. So the potency scales in homeopathy, just to give people a little bit of an education, the X potencies are the lowest ones. X is the Roman numeral X, so they're in the tens. So they've been diluted tens of times over. Um, C is the next potency. So like a 6C or a 30C or a 200C, that's in the Roman numerals 100. So they've been diluted and succussed repeatedly hundreds of times. Then we get into the M potencies, which are Roman numerals 1,000. So they've been diluted thousands of times over and over. So you can get 1M, 10M, 50M. You can imagine and they get more dilute each time, how dilute and how many times these remedies have been diluted, and succuss being that banging on the palm of your hand.
Yes.
But instead
Wow.
of 5 times, they do it 100 times for each potency. So you dilute 1 drop into 100 drops of distilled water, succuss 100 times, then you have your next potency. Then you dilute that 1 drop into 100 drops, succuss 100 times, you have your next potency, and you go up and up and up and up.
Okay.
Yeah.
What's the difference between a C and a CK? Like 200C and 200
They're the
CK?
same. They're the different types of there's a CK and there's a CH.
Mm,
So C is, I'm trying, why is it escaping me what a C is? So there's either CH or CK. So CH is Hahnemann, Samuel Hahnemann.
mm.
CK is Korsakoff. They're essentially the same, but they're just a little bit of a different way that they formulate and succuss the remedies.
Oh,
But they're essentially the same thing.
okay.
There's no difference.
Interesting.
Yeah. CH and
Okay.
CK are the same.
Yes. Well, because I have been advised to get like a 200C, and then, the only thing I see available is a CK. And so, okay, that's
Yeah, that is a C.
okay.
Yeah.
And then do you have a preferred brand that you like for homeopathy?
Well, I do like there are 2 brands that I
Okay.
have a lot of faith in. Almost any brand that's come from a homeopathic manufacturer will be safe and viable. And Boiron, which is Canada-based, and Homeocan also is Canada-based. I really like those 2 remedies. I get all my remedy supplies from Homeocan as a homeopathic practitioner, and then I make up my own remedies with the sugar pellets and the medicating potency. That gets a bit complicated to explain, but I basically get my supplies from Homeocan and then I make my own remedies. If you're buying remedies over the counter, I would probably go with Boiron, Boiron. Um, each Boiron pellet goes through the manufacturing process, and you get the little, like small peppercorn sized granules, pellets, and each one has a little drop of the medicating potency of each, like a little pinpoint drop.
Mhm.
So you can rest assured that those remedies are good and will work. So if you're buying over the counter, if you're buying online, I would say probably go with Boiron.
Okay.
If you're in the States, also Hahnemann Pharmacy, you can get remedies from that are made by Hahnemann Pharmacy in California. There are quite a few different brands out there, though, but those are kind of the ones that I trust the most.
Okay. And then how would you go about finding a homeopath to work with?
Yeah, that is the tricky part. You can try to find a veterinarian that is holistic and is trained in homeopathy. And if you're in the United States, there's the American Veterinary Medical Holistic Medical Association. I'd have to look that up, but they do have a list of veterinarians that have homeopathic qualifications, and that's Dr. Richard Pitcairn that has usually trained those veterinarians, and they probably have the best homeopathic skills of veterinarians in the States. In Canada, it is more difficult. There are some vets that have taken the Pitcairn course. Ideally, what you want is somebody that's a fully trained homeopath. I would almost prefer that a homeopath that does classical homeopathy and has some knowledge of animal pathology would treat animals, as opposed to a veterinarian that has kind of minimal training. Because still, a homeopath that's taken 3 or 4 years to get their diploma understands the principles of homeopathy, the dosing and repetition of remedies. You would choose the same remedies as you would if you treated a human being, but your dosing and repetition is going to be a little bit different with animals. because animals have a shorter lifespan. They can improve more quickly. They can also regress more quickly. So sometimes you have to do remedies for a bit longer with an animal. But when you have chronic disease, I do remedies daily. I do combination remedies daily. In a chronic disease process, what I have found, especially with older animals, especially with things like kidney disease, especially with things like thyroid disease, these aren't necessarily things you're going to be able to cure, but they are things that you can manage. So you can manage to get thyroid levels to either come down in a hyperthyroid cat if it's not really advanced. You can get kidney values to improve when it's not like stage 3 and 4 kidney disease. But even in those stages, homeopathy can still really help. So even though their numbers, we might be able to stop it from getting worse, but we can manage the symptoms better with homeopathy. Um, so finding a homeopath, technically with the regulations, with the veterinary associations, the veterinary colleges, technically a homeopath is supposed to work in clinic under vet supervision. Some veterinarians might have a homeopath working with them, and then that's really the best option. Or a veterinarian that has taken a more extensive course in homeopathy.
Okay.
Yeah.
Okay. I am familiar with the like find a holistic vet finder that you
Yes.
referenced earlier, so I'll include that in the
Good.
description for folks. But I was thinking while you were talking, what if I am a veterinarian that wants to get into homeopathy? Where do you go for that?
Yes. Well, there is the Pitcairn course, Richard
Okay.
Pitcairn's course, and it does teach classical homeopathy. Um, it's actually quite tricky because I wouldn't say there are a lot of homeopathic courses available to veterinarians. There are some animal related programs out there for veterinarians where then they have all the background they need in anatomy, physiology, and pathology. Now they just have to know how to treat with homeopathy instead of drugs. There are some veterinarians who actually decide to become homeopaths, and then they apply their veterinary knowledge and homeopathic knowledge and combine the two. Um, but it is tricky.
Would so I know that you offer a course
Yes.
for like pet owners like me and stuff like that. Would your course be beneficial to a veterinarian, do you think?
Well, I think the course would be beneficial to a veterinarian because I am teaching how to repertorize and arrive at these remedies. I'm teaching the fundamentals of homeopathy, the principles of homeopathy, remedy reaction, dosing and repetition of remedies to deal with acute and first aid injuries and illness. So when it comes to chronic disease, it's not a huge leap that we have to make to apply the principles of homeopathy to chronic disease. Um, the course will give it's a 40-hour program, but it's a good introduction, and it would be helpful for veterinarians that want to incorporate homeopathy to at least start using it in acute situations and injury situations. I eventually want to, and it'll probably take me a while to do it, provide a course for veterinarians to be certified in homeopathy and for homeopaths to be certified in homeopathy.
That would be really neat.
So somebody who already has their homeopathic designation or has all the veterinary designation they need to understand animal pathology, etc., um, and learn how to use homeopathy for it.
Yes. Yes, that would be great. I kind of went around the back door on that one, but will you please tell us more about your course that
Yeah.
you offer?
So the reason why I started this program is because, and especially it sort of started out in the post-COVID era. But during COVID, it was very difficult to get medical care and also veterinary care. So veterinarians weren't allowing you to bring your animal into the clinic. A lot of people were just trying to avoid having to even take their animals anywhere. And for our own health, I mean, it grew out of a need to be able to try to deal with things at home as best we can without having to seek out medical care. So what we found was access to veterinary care was becoming more limited, and we have a shortage of veterinarians. We definitely have a shortage of veterinarians doing holistic medicine, and more holistic vets are retiring, and there's not a lot of holistic vets taking their place or being taken over by conventional vets who don't have the same philosophy. So whenever we can deal with something, whenever I can provide an education and a foundation of knowledge in animal vital signs, assessing your animal at home. Do I need to go to emergency right now? Do I need to set up a vet appointment? Or can I use homeopathic remedies effectively and confidently at home when it's appropriate to use them to see if we can turn things around? And there are many things on an acute illness and acute injury level that we can deal with at home. But I think people don't have the knowledge or the like a fundamental education in homeopathy, which I'm trying to provide with this program, to know how to confidently and safely use homeopathy, and also understand when it's really time to go to the vet and when you can actually wait and give it 24 hours and see if your animal will turn around. And then
Yeah.
which remedies to use and how to use them and what potency to use and how to even give the remedies to our animals. So the beautiful thing about homeopathy is it's a very gentle, and there really are no side effects, negative effects with homeopathy. If you're not giving the right remedy, it's just not going to do anything.
Yes.
I mean,
Yes.
we do have something called aggravations with homeopathic remedies, and that's where the symptom picture gets worse. And if you're ever giving a remedy and the symptom picture gets worse, which is technically an aggravation where their current symptoms are worse, you stop the remedy, and within 24 to 48 hours, they should be markedly better. So it's also knowing how long to continue a remedy, when to change remedies. Okay, this isn't working, right? We mentioned
Yes.
before in our previous interview with constitutional or classical homeopathy, you would give a dose of a remedy to somebody or 3 doses of a remedy to a human, and then you do a follow-up 4 to 6 weeks later.
Yes. Yeah.
So with animals, you often don't have the time to do one remedy and then wait even for a few days to see if the remedy's working. You need to be able to know how to use these remedies to shift that symptom picture fairly quickly, especially with acutes.
Yes. And so all that is covered in your course.
All that is covered in the course. So I get into the fundamental principles of homeopathy, foundation in homeopathic understanding, how to repertorize, how to use a homeopathic repertory, how to use a materia medica, how to find the remedies that are going to be best used for any symptom and circumstance when it comes to acute and first aid stuff and illness. And then I also go through virtually every acute injury, acute illness, and give you hands-on, these are the remedies to use, here's how to use them, here's when to change, here's what potency to use. So we go through kind of all the top remedies for every different situation. So it's
Okay.
pretty intense. I also want to give people more hands-on knowledge about animal anatomy and physiology as it relates to those different acute symptoms and illnesses, and also hands-on knowledge so that they understand blood work, that they understand vital signs, that they know what all the numbers in the blood work are so that they're not just completely relying on the veterinarian. So it's more
Yes.
knowledge, more expertise, more experience, and more understanding so that you're not completely in the dark when you go into a vet clinic and you get blood work back. Because the unfortunate thing is that vets are also making more mistakes. And that's just a reflection of the stress and the caseloads. And sometimes they're waiting for a week. People are waiting for a week to hear back about blood work, and they're worried about their animal. And maybe nothing's wrong in the blood work, and that's why the veterinarian isn't calling you back, but you don't know that.
Right. Yes.
So I always tell
Yes.
people when you go to your vet, when the blood work is back, you want that emailed to you right away.
Yes.
You've paid for that. It should be emailed to you. And sometimes the staff will say, well, they want to talk to you before we email it. It's like, you have a right to that. And then if you have some knowledge, then you can already see, okay, it looks like the BUN and the creatinine are elevated. So that tells us we have some kidney stuff going on. If the ALP or ALT are elevated, that's liver values. If the thyroid, the T4 in a cat, is high, then we have hyperthyroidism going on. So I just go through all that stuff so that it gives you, you feel more confident. You don't feel so at a loss about
Yes.
people's own health.
Yes. Yes. I feel like I've defaulted learned that stuff over the years because I had an ALT cat and then yeah.
Yeah, yeah,
Um, but that's really good knowledge. And in our last interview, you mentioned that you also point out things like to look in their mouth, like when do you go to the vet or when can you stay
yes,
home and try something different, which I also
yeah,
think is not only so helpful for your pocketbook, but also so helpful for like stress levels. And I hate when it's, 11 midnight and I'm like, oh, should I go to the emergency vet or not? Are they going to be okay until the morning? So I think that's so invaluable.
yeah, totally. There are some basic things to know what a normal respiration rate is, how to take a heartbeat to see if the heart is, beating out of control. Checking gum color, which is called capillary refill. If you've got an animal that is looks like they're abdominal breathing, where they're kind of sucking in air from their abdomen as opposed to a normal smooth breathing situation, that might be an emergency, especially if it's combined with their gums are really pale, where you press down on the gums and the color should come back. They should be pink and it should be a healthy color. If you press down and it takes a few seconds for the color to come back, as opposed to like 1 to 2 seconds, it's 3 to 4, or it doesn't come back at all. That's going to be an emergency because they're having problem with oxygenation, or there's something major going on. They could be having an internal bleed of some kind. So it's having some basic understanding of how to take vital signs to know how serious a situation is. So
Okay.
that, like, capillary refill is one of the things that people really, it's a quick way of assessing, okay, how bad is the situation?
Yes.
Having trouble breathing, those are emergencies.
Yes. Or if the gums are yellow,
Or the
that
gums are
too.
yellow.
Hmm.
Yeah. Then we have a problem with liver or other digestive organs are having real trouble.
Yes.
Yeah.
For those that don't know, that's what happened with my cat Trig that passed away. He was jaundice, and so that's why I made that face when
Yeah.
I said that.
Yeah.
So you are offering 10% off with Floppy
Floppy,
10.
the code floppy10
Okay.
on my teaching website, which is homeoed.com. Floppy10 provides a 10% discount on the course. It's a 40-hour program that's run one weekend a month for 4 months. And the next one starts October the 19th. It's a
1 week in a month for
self-directed
4 weeks,
for 4 months.
right? Oh, four
So one
months.
weekend a month. So
For four
October,
months.
or
Okay.
December, and January.
Okay. Got it. Okay. I will
And it's,
include the links and all that information also in the
yeah,
description so people don't have to write it down.
great.
Um, Anything else kidney disease wise? Like, I guess one of the things that I would wonder if I was watching this interview would be like, okay, so, but how do you know when to call it? There's at some point where We can't fix the kidneys anymore.
Yeah.
Can't keep them running.
When to call it is if they really have stopped eating
Okay.
and they are flat and they don't seem to have quality of life anymore. They're either vomiting all the time. With really advanced kidney disease, they get muscle wasting, they get ataxia where they just kind of fall over. Um, when to call it is when their quality of life is no good anymore and they don't seem to be happy. And especially when they stop eating and you have to force feed them, it's almost like, how long do you want to keep them kind of in that state?
Right. Yes.
They'll be dehydrated even though you're giving them fluids. They'll
Yes.
usually start having that really uremic smell to overall, like their breath can smell bad. Everything starts kind of shutting down.
Yes.
If they're still eating, even if they're really skinny, but they're still getting around, they're eating and they seem still happy and they don't seem in pain and you're managing it okay, then there's no reason why you can't continue with that. You call it when, they're really not enjoying life anymore.
Okay. That's fair.
Yeah.
I wasn't sure if they're, sometime in my history with kidney disease, it, I would be like, okay, I think it's time to call it. And then, they'd bounce back for a little bit. So
Yep.
that's when I'm like, I don't know. But what the things that you pointed out of actually my last kidney cat died, he ate the day that he died.
Yeah.
So, but his quality of life was so poor that it wasn't
Mm-hmm.
worth it.
Yeah.
Yeah.
Yeah. And they can do that. Like my dog, Toby, my origin story with Toby. I mean, he had a huge meal on his last day, but
Mm,
he almost couldn't walk anymore.
right.
And he couldn't get out to go to the bat. Like, I had plastic down underneath him. It's like I mean, he's just basically existing. He doesn't have
Yes.
life anymore. So
Yes.
even if he's still eating, I mean, that doesn't necessarily mean that he's has quality.
Yes. And that's a good thing to point out too, because I remember my vet being like, I cannot believe that this cat is still eating. Given
Yeah.
his numbers, I cannot believe that he's eating. She's like, he is only eating for you.
Mm-hmm. Aw.
So yes, and it was um yeah, I he was my mom's cat and or my parents' cat, but I was the
Mm.
care his last 6 months of caregiving, and so it wasn't up to me when he got to be euthanized, and so it just yes, it was a lengthy process. So I think it's
Mm.
important to be aware of that
Yeah.
quality of life, yeah, and
I
the
think,
existing thing.
yeah, existing and just sort of hanging on by a thread to life.
Yes,
If that's the case, they will probably um, pass on their own at some stage, but
mm,
intervening, you have the option of intervening because we have that option
yes,
and we can end suffering.
yes, which is really really nice,
I
even though
wanted to
it's a hard
say
pull.
it is a hard, well, yeah, because we don't want to let them go.
No,
We want them to be with us forever.
that's right. Darn it.
Yeah. I
You were
wanted to
gonna
say
say, okay.
I wanted to say one other thing. So it's important, like annual blood work is important once they get to be, you know, starting at maybe 8 years old, 10 years old. That I think should be middle age for cats, but they consider them to kind of be seniors with dogs, maybe start at depending on the dog and the lifespan, the usual lifespan of that size of animal. Get blood work done annually starting sort of middle age or even every 2 years starting at middle age if their blood work is fine because doing blood work tells you if something is starting.
Mm,
So if kidney disease is, we start seeing kidney values going up, we can start supporting those kidneys right away then. And then you have a
yes.
much better chance of turning it around and preventing it from getting worse.
Yes.
So that's important. Blood work is a fairly non-invasive thing. Well, some animals consider it to be very invasive,
Yes.
cats. But blood work is something simple you can do that gives us a lot of information,
Yes.
catches things early. Same thing
Yes.
with exams. Or, you said looking in the mouth, right? So look in your animal's mouth. Make sure their teeth are okay. Make sure there's no weird things in the mouth. Check their ears, check their eyes. Get used to feeling the body, how to palpate. Um, it's kind of something I think everybody should do is feeling for lumps in the body, getting accustomed to what their normal respiratory rate is, what their normal heart rate is, so that when something is wrong, you know how far of a deviation that is from their normal.
Mm-hmm.
Because every animal will also, normal can be a range.
Yes.
So every
Yes.
animal is an individual and can have an individual normal range. So then, you can have this up on your fridge as this is their normal, so that something's going on, you can see how severe it is away from what their normal is,
Yes.
what their normal gum color is.
Yes.
Yeah.
Yep. I
So
speaking of normals, like I did not know that BUN and creatinine can be higher in a raw fed cat.
BUN, not creatinine.
Oh,
So blood
okay.
urea nitrogen is a product of protein metabolism. So animals that are on a raw food diet are on a higher protein diet and are metabolizing protein as they should be normally. It breaks down faster. Um, BUN, the values are a little different in the States, but BUN can be 2 or 3 points higher
Mm,
in a raw fed or a high protein fed animal. All of the values are based on kibble fed animals. So yes, BUN can be higher, but creatinine should be normal. And specific gravity, SG, concentration of urine, should be normal as well. So
okay.
the only elevation would be BUN, and it's, if it's like 5 points, 6 points, 10 points higher than normal, that's not because of the raw food diet. That's because of kidneys. And you'll usually see an elevation of the creatinine as well.
Okay. Okay. I first heard it was BUN, and then someone recently told me BUN and creatinine, so that's good to know that it's just BUN, and that makes more sense to me.
Yeah, it's a blood urea nitrogen.
Um, why are the values different in Canada than in the US?
It's just a different measuring value,
Mm,
but it's like what's high or what's low. You can still
okay.
see, but just the number is different.
Okay. Interesting.
And I don't
And
actually
it,
know why it's different in the States.
yeah, because I feel like everything medical here is in the metric system. So um, I know we haven't gotten on board with everything else
Yeah.
with our English measurements, but at
Yes.
least the medical system is like that. So that was curious to me. And also, like, why don't we make all of that kind of stuff universal? It's just,
Yeah, it
oh
should be.
well.
It should be
Yes.
universal. But what
Yes.
is the same in any blood work, no matter where it's done, is whether the elevations are high or whether they're low. So it's not
Okay.
so much looking at the number, it's looking at what's out of range.
Got it. Makes sense.
Yeah.
Do you know if there's any situation where, like, I don't know, the creatinine could be high because last week he was more dehydrated before he got his blood work done?
Yeah, it's in terms of uh more dehydrated. That shouldn't actually affect the kidney values. What that will affect is the concentration of the urine.
Mm,
So if they're more dehydration um, can cause changes in some of the blood work numbers, and oftentimes at the bottom of the blood work, the pathologist will say dehydration question mark, like are they dehydrated?
okay.
Um, Dehydration, I think, can actually cause higher concentration of urine, if I
Oh,
recall. So this is getting into more specific analysis of blood work and urinalysis.
Yes.
as to what dehydration can cause on a blood panel. But with a kidney cat, the level of hydration might help the values a little bit with BUN and creatinine. The specific gravity is probably still going to be low because if they've been hydrated, the specific gravity is going to be less. So
Okay.
the urine will be more dilute. It's the same thing when you're assessing kidneys, more in a dog because dogs will not pee overnight and then you take them out for their first morning pee. That's
Mm,
going to be the most concentrated urine of the day.
yes.
So when you're
Yes.
assessing kidneys, you always, with a dog, want to have their first morning urine sample. Cats are peeing at all hours of the day and night,
Right. Right.
unless you take their litter box away and you make sure so that they don't pee before they go to the vet if they're going to have a cysto into the bladder to get the urine, or if you're
Yes.
collecting a first morning urine sample. But usually with cats, you just take whatever sample you have available at that time.
Okay.
Yeah.
Got it. Thank you again.
You're welcome.
I'm excited to get these up online so that they can help other people because
Yeah.
I wanted these kind of things. So thank you for doing this. I really
You're very
appreciate it.
welcome.
I will include a link to Andrea's website and also her educational website, I think is how you refer to it.
My teaching
And
website,
your
yes.
teaching
So I
website.
have my own personal website for homeopathy, and then homeoed.com is the learning platform and the teaching website where the course is there. And I'll have more courses coming down the line as well as I develop that website.
Okay. I will include both of those below.
Wonderful.
Thank you,
You're very welcome.
and I'll see you later.
Okay, thanks, Jenny.
Bye.